Welcome back. We continue with some hopeful news. Kenya is set to start manufacturing COVID-19 vaccines by the year 2022 in a bid to scale up its vaccination exercise to reach herd immunity. As at 19th October, 4.6 vaccines were administered across the country, with about 3.3 million people being partially vaccinated and over 1.2 million people being fully vaccinated. Kenya still strives to vaccinate 10 million people, by December, with the availability of multiple vaccines across the board.
18 months on, Kenya has managed to record a positivity rate of below 5% in slightly over 2 weeks now. And in line with the WHO regulations,
we have improved our oxygen generation capacity in all our public health facilities from 3 million litres per day in March of 2020 to 32 million litres per day in October of 2021.
The epidemiological scope of COVID-19 has seen the country ravaged through 4 waves, with the country's health capacity stretched beyond measure.
At the beginning of the pandemic last year, we used to ship our samples for testing in South Africa, and the result turnaround time would be anything up to 5 days onwards. Today, we have our own capacity. These strategic diagnostic investments have strengthened the country's healthcare system, especially in response to the COVID-19 pandemic, and will propel us faster towards the attainment of universal health coverage.
But strides have been made from one testing lab at Kemri, when the first case was reported in Kenya in March 2020, to now more than 95 laboratories across the country. Expansion in research has seen Kenya becoming a center of genomic sequencing in the region, and as well as helping detect the various mutations of the virus, including the Delta variant. The pandemic has also seen the active role played by community health volunteers.
In a bid to bridge the gap in human resources for health, the government has progressively recruited an additional 36,900 healthcare workers in the last 9 years, bringing total public health workforce to what it is today, 75,000 health workers.
Helen Aura, NTV.